guys, it's Dr. Bush, Dr. Snodgrass, and today we're here to talk about a really tough topic to think about and to really talk about and explain to you. But we hope that we'll be able to do that in perspective that will help you to understand some of these terms.
Yes, if you have a child with severe hypospadias, then you may have heard doctors talking about ambiguous genitalia, intersex, or differences in sexual development, DSD. You may have heard that term, micropenis, and of course all of this in the context of hypospadias. As you know, we specialize in treating patients who have severe hypospadias, and so we frequently are asked these questions by parents, and parents contact us frequently for clarification of these terms that they've heard by doctors in their own community. So for that reason, we've put together this little discussion to try to explain it in a clear way that helps you to understand it better. So it's obvious already that we're saying this is complicated, so just bear with us.
There's all sorts of terms that you may have never heard about before this. We'll go through that, but we do want to say that there are pictures of genitals in this discussion, so if you're watching this in a place or around kids that bothers you, you might want to put it on pause and watch it some other time.
So we'll start by saying from the beginning, we're coming from the perspective of hypospadias. We are hypospadias surgeons. And hypospadias is not ambiguous genitalia or intersex. Hypospadias is hypospadias. Ambiguous genitalia is something different that we're going to talk about. Intersex is something different that we're going to talk about. And these can overlap a little bit, but they're separate.
I always like to kind of describe it. I know you know that spray paint can that's there that has the 3 different circles of different colors, and they kind of overlap just a little bit to give you a new color in between. That sort of image is really, I think, the best way to understand that hypospadias is over here in this circle, that DSD/intersex is over here in this circle, and that ambiguous genitalia is up in this circle, and they can all 3 overlap in various ways, but for the most part they don't, and people who are in this category are different and separate patients than ones in this category and ones in that category. So we'll help hopefully let you understand which of those 3 circles that folks belong in.
So let's define ambiguous genitalia, because if you've Googled that or looked it up, it's not so clear what it is. And unfortunately, even healthcare professionals can use this term rather loosely. So we're going to define it very specifically. Ambiguous genitalia are what's present when a newborn is looked at and you can't tell by examining them, by looking at them, is this a boy or a girl? So let's give an example. It would be easier to see a picture. So we're showing 2 pictures of newborns that look very similar to each other. Okay? This one is a boy who has severe hypospadias. The other one that looks very similar, we don't know. The other one is ambiguous genitalia, because this could be a girl that looks more like a boy because of excessive hormones that were made during pregnancy because of an adrenal gland problem. Or it could be a boy who has hypospadias. So what's the difference? I mean, this boy does not have ambiguous genitalia. The other infant does have ambiguous genitalia. So I hope that makes it clear that things that look the same don't necessarily have the same label. And this is the problem. Even some healthcare professionals might look at these 2 patients and say both of them have ambiguous genitalia, but they don't. And the difference is the testicles. You can't tell on a picture, but we'll tell you that this child has a testicle that we can feel right there and right there. And so we know if we can feel testicles, it's not a girl who made too many adrenal gland hormones, and therefore there is not ambiguous genitalia. The other child, we can't feel a testicle on, so it's either a girl or it's a boy where the testicles are still up in the abdomen where you can't feel them. So we don't know which it is, and that's why the term ambiguous is appropriate in that case.
It means some additional tests will have to be done to decide which of those categories. So let's just be clear. When it comes to ambiguous genitalia, I think a lot of healthcare providers and parents get confused because they're looking at it as something that can be defined by looking at things. But really, when it comes down to it, this is something that needs to be decided with an exam. And if the exam demonstrates that one or two testicles is present, it's not an ambiguous condition because all of the literature says this is a boy. Okay? That's different than when no testicles can be felt, where there can be a question of what's what.
So what's intersex? And again, that's a huge topic in and of itself. But
And we're
we're talking
shifting
about
gears now from the ambiguous kind
circle,
of appearance of
right,
things to now this different category of intersex, also referred to as DSD. So those terms are used interchangeably by most groups. Mm-hmm.
Yeah, so in this case, what we're talking about are boys with hypospadias who maybe have some girl parts too, and we're going to illustrate that. But what we have learned from parents who contact us and who see us with their child is that when the doctor came in the room and said, well, you know, your child has ambiguous genitalia, maybe there's a intersex disorder here, that what you hear from that is frequently, is my boy really a girl? And again, this is what we want to address. So here's an example of a patient who has both hypospadias and an intersex condition, or maybe has it, we don't know yet. But what's different in this patient and the ones we showed a minute ago, here's the testicle we can see for sure. Here's a penis that has hypospadias, but we can't feel any testicle on this side. So that means it is a boy with hypospadias who maybe also has an intersex or DSD condition, but not very often.
That's right. When you look at the numbers of kids, so now we're talking about a very small group of kids with hypospadias that also have a testicle that can't be felt. Okay, that little small group of patients, out of those, only 1 in 3 will have some sort of condition that's known as a DSD condition, which means 2/3 just happen to have a testicle that's in the wrong spot or that didn't form correctly for whatever reason. But most of those kids just have hypospadias. They're not in that little bit of overlap in hypospadias and DSD, but about 1 out of every 3 who happen to have both hypospadias and at least one undescended testicle that can't be felt may have a DSD condition. And those kids are going to potentially need some additional tests and evaluation for things.
But we want to stress that these are still, all of these, the ones with intersex conditions in this group, or other ones without an intersex, they're all boys. And we've said that now several times, and she already explained it to us. Studies which have looked at these kinds of children when they've gotten older and have had evaluations all agree that if we can feel a testicle, this child will grow up seeing himself as a boy and behaving as a boy. So this is a boy who has potentially an additional diagnosis besides just hypospadias.
Now that's different, and we're going to shift gears
for another
one more
circle
time for something called micropenis. And that's because this term is used very frequently by healthcare providers, and probably inappropriately so. So when we talk about micropenis, what it really refers to is a penis that, when it's stretched out, measures on a kind of math scale more than 2 standard deviations below the average length. So if you're just putting that in English, it means that it's less than 2 centimeters long, less than an inch long. But structurally, these are almost always totally, completely normally formed penises that just happen to be on the small side, typically because of a hormone reason that's associated with a brain issue, not because of a hormone issue associated with the actual penis itself.
And the boys who actually have true micropenis, it's not even considered normally an intersex condition. So another way to look at this, the way I explain to patients in the office, because many parents ask us about if their child has micropenis, because this is what they read on the internet. And so if we look at just heights of people, and if we got everyone together and lined them up next to each other, shoulder to shoulder, what we would see is shorter people, taller people, and then fewer taller people over here. So we have this average height that people have. And so there's our shorter people and taller people that are still all normal. They're all normal. But if you get really small, well, then you're smaller. You've fallen out of what's considered normal. And it's the same thing here. We're talking about a penis that when you stretch it, as far as you can stretch it, is still smaller than the normal length would be. So, and that's very unusual in hypospadias. Now, let's apply it, though, specifically to the situation we're talking about. Now, that is a patient that has severe hypospadias. And if you look at it, again, you might think, oh, that could be a girl. But you can see in the picture there are two testicles. So this is a boy. This is not ambiguous genitalia. This is not intersex. This is just a boy that has a severe proximal hypospadias. And if you go to measure the length, these boys have curvature of the penis. So how do you stretch this bent penis to where you can actually measure the length? And more importantly, if you measure it when it's bent like this, well, that's not actually the true length of the penis. And when we do surgery to straighten this, it's the best way to straighten it is to lengthen the short side, that underside, and then the penis is much longer, and the measurement here now is entirely in the normal range. No question about it. So it's really important for those of you who are worried about this term, micropenis. Very, very few boys with hypospadias truly have a micropenis. Our practice is, well, it's almost all proximal hypospadias nowadays.
Well,
and
we
have
just measurements on thousands of penises, and of those we know a couple. One that has a known hormonal component that affects the size of the penis, and another one that had multiple other medical problems, that actually had a chromosomal issue, but that he also had lung problems, major heart problems, etc. So it's a very, very, very teeny tiny percentage of boys with hypospadias. We see lots of boys with proximal hypospadias, and almost none of them end up in this category of micropenis. But part of that also depends on how the penis is corrected in terms of the curvature. So there are some surgeons, in fact, probably the majority of surgeons that we know about throughout the world, who tend to straighten the penis by shortening the long side. And at the end of the day, you'll end up with a shorter penile length, versus surgeons that lengthen the short side, which will end up with a longer penis. And so some of the studies, for instance, that were done on men who had proximal hypospadias many years ago, before it was known how to correctly lengthen the penis, there can be some differences in penile length because of that. But when you lengthen the penis routinely, those boys always end up with a normal length of penis.
And this is another question that comes up related to this. Many parents are told, well, the penis is small. Mm-hmm. Your boy needs to be treated with testosterone, especially before considering any surgery. And again, we'll point out that no, the penis isn't small. The penis is in the normal range. It's bent. That's right. It's not short. It's bent. And so we're going to fix that by unbending it, not by stimulating it with hormones. So for many reasons that are beyond the scope of what we're talking about, we don't use preoperative testosterone therapy. And here's another case where it comes up, and we have found that it's not necessary to get good results from surgery. So in all of this, let's admit we're talking about conditions which are uncommon. In fact, in the United States, every year, only 1,000 boys are born who have proximal hypospadias. And if we look now just at that group, the number of boys who have appearances like what we've been showing in this is less than half of them. So less than 500 boys a year. Now think about the size of the United States, how many hospitals there are, how many birthing centers there are all over the country. And imagine that there's only 500 boys that are born that look something like what we're talking about, and you can see how the doctor working in the newborn nursery maybe doesn't see anything like
has
this.
Never seen anything that looks exactly like this, and can easily get confused and use some of these terms incorrectly.
Right. And so we know, again, part of what's prompted us to have this chat with folks or case like this is an extreme example, but it happens, and so we wanted to mention it. Anybody at a glance looking at this child, a newborn, would immediately first think, well, that looks like a girl. Of course you would think that, except that if you separate the skin a little bit, you see a penis in there, and if you feel there, we can feel both testicles. So even this case, which anyone would say, that looks like a little girl, except now I'm not sure if that's a girl or a boy, is not ambiguous genitalia because we can feel the testicles. But when this child is born, the doctor in the newborn nursery is not so sure and is very nervous.
They've never seen anything like
Never
this.
seen that. And they're afraid if it is a girl with an adrenal gland problem, those girls can become very ill in a hurry. So they don't want to miss that. So they're not sure. So
Even
we're telling
though we
you,
know there are testicles,
it's a
can't
boy.
be a girl with an adrenal problem because you can't form testicles in that circumstance.
If you're a girl,
If you're a
right.
girl, we know that.
But they're not sure, and they don't want to have a sick child that they've overlooked something. And so very often this is what happens. They call the endocrinologist.
And those are the hormone specialist doctors.
Right. And so they come, and even when they can feel the testicles, what we see reading their records and all is that they're not sure. And so they refer to it as ambiguous genitalia. They may tell the family, let's be careful about what you name the child and all of that. And then they do tests to see if it's a girl or not. And in some cases, we've seen this even when the testing was done before birth, it showed the normal chromosomes that go with a boy. So that just emphasizes again how these are rare conditions, and people want to avoid making a mistake. So then they do these tests and it says, nope, it is a boy. So then they look at it and say, well, but the boy doesn't look like he's had enough male hormone because it looks kind of like a girl there. And so then they want to do some tests to check out the male hormones, again, suggesting to the family or sometimes just telling the family, we're not sure that if you raise this child as a boy that he's going to think himself as a boy. And then maybe the pediatric urologist comes in and looks at him and says, oh, wow, that's going to be really tough to fix, and that may be a whole lot of surgery. And if we meet together and talk and decide maybe you want to think carefully about how you raise a child. This is real life. I mean, we've heard this from several individuals. So we're not pointing fingers at people. We're sharing an experience to try to give an answer. And so in the course of all this, again, testosterone inevitably gets mentioned, et cetera, et cetera. And we have had cases, in this child whose picture I show was one of several that we've seen recently, where after the end of the day, after all this evaluation, they were advised to raise a child as a girl, even though, as we said earlier, the publications which are available say that if you do that, there's going to be some real problems later on, especially if surgery is done to remove those boy parts, because that child with testicles that you can feel there, all the information that's available today says that that child is going to grow up and see himself as a boy. And we've seen some patients who look like this who were adopted by families from third world countries and had not had surgery. One of them was a 4-year-old boy, and the mom was told by a urologist, well, I think you need to be careful about calling that a boy. And mom said to me, the child runs around playing like a boy all day long. So, again, we're sharing these experiences. And we're not in any way suggesting that this is common. Well, it's not common because only 500 boys in the United States, and not all of them go through this. But we've been contacted by families from around the world with similar stories to this, and so we're mentioning it. That's why it's important. What we stress to our colleagues is we have to be aware of this, because we didn't know this before in the past either, and we have to use these words, hypospadias, ambiguous genitalia, intersex, and micropenis more carefully. So again, here's a patient here. This is a boy with proximal hypospadias. There are 2 testicles. The penis is severely bent over, as you see there. In fact, if you just look at this child, it doesn't even look like there is a penis, although we can all see the 2 testicles there. But, that's what it is. So these are cases of the type that sometimes lead to these discussions. But we want to leave you in a more optimistic thing. This is why we have the center that we do, because here are pictures of some of the most severe hypospadias before and after their surgery.
And our goal is to create a totally normal looking penis. And the nice thing is, as we've told you, this isn't a micropenis sort of scenario. These are normal penises that happen to be bent and with an opening that's in the wrong spot. And those are things that can be fixed.
And can be fixed in few operations without scars that are visible. Our incisions are all in natural skin lines. And when we're finished, I think you can look at every one of these post-operative pictures. And if you opened the diaper and looked at a boy that looked at you, wouldn't even know that they had had surgery. So we show you that to also give you hope and to say, even the most severe hypospadias can be corrected with the opening all the way out at the tip to make the penis straight and to look quite natural. So what's the message in all of this? Let's summarize all of these things we've been talking about by starting out by saying boys with hypospadias have hypospadias. They're boys where the penis just didn't quite form all the way.
And if there's a testicle that's there, the genitals are not ambiguous. The ones that are ambiguous are where you cannot feel either testicle, and that's where some additional testing needs to take place.
Which is what she just said. If you can't feel a testicle, one testicle, we've already mentioned that there could be an intersex condition, but it's still a boy. It's still a boy. We don't have to worry about how that child will view himself, how he will act later on. It's a boy.
But he may need some additional tests because a small minority of folks can have some other condition that it might be important for us doctors to know about.
And again, if you don't feel any testicle, Dr. Bush just said it, then we do need to test it to see if it's a boy or girl. And see, again, we said this now several times, the only situation where we have a question when we're looking at a child with hypospadias, is this a boy or a girl, is if we can't feel any testicles at all. And in most of those cases, it's still a boy. A few of them will be a girl. These are quite uncommon circumstances. It happens, but it's not very common. And the difference between is it a boy or girl is made very rapidly, usually within just a few hours.
And the penis in severe hypospadias, even the worst case scenario, some of which we've shown you here, is still not a micropenis. A micropenis is a different thing that's usually a totally structurally normal penis that just happens to be physically very small. And so what we're talking about in severe hypospadias are penises that are bent, not penises that are small. And all of these can be fixed so that they can look normal with a circumcised appearance, sometimes even with foreskin reconstruction, depending on the family's wishes.
So we hope this has brought some clarity to a confusing subject, and maybe some relief to some of you who may be in the midst of this kind of worry right now. We know that it's so distressing, first, to have a child born with a birth defect, to have hypospadias that you've not heard of, and that your support people in your life, your parents, your friends, have never heard of, and then to add on top of that other words like ambiguous genitalia and intersex and micropenis. Oh my gosh, it can be just totally overwhelming. So again, we hope that this is helpful, and if you have other questions, or if you're in the midst of this and you need a little bit of guidance, we are more than happy to help.
You can check out our website at www.parcurology.com, or email us at info@parcurology.com, and we can try to help as best we can in this difficult circumstance. Thanks.
Thank you.